Steroids in America. The recent news of Alex Rodriguez, the beloved superstar, linked to steroids and performance-enhancing drugs caused an uproar in the homes and the media alike. But what is it about these drugs that makes it so enticing to athletes? Now, the sports world was shocked to find out that A-Rod, Roger Clemens, and Jason Giambi, amongst others, were also noted to be linked to performance-enhancing drugs. Now, this is a trend that is just not prevalent in sports. It's also linking over to our teams. Chris Benoit, a professional wrestler, was noted to be on steroids at the time when he murdered his wife and then committed suicide. Steroids has become a $10 billion a year business that is now linking over into our entertainment field. Law enforcement has started targeting anti-aging clinics that are prescribing these drugs prior to doing examinations. A Times Union article states that Mary J. Blige, along with 50 Cent, Justin Timberlake, and others, are now being probed in an investigation for trafficking steroids. What are anabolic steroids? A Sweet 101 article defines anabolic as growing or building, and steroids as derived from hormones. So anabolic steroids are derivatives of testosterone, a natural male hormone. The drug is normally used to treat growth deficiencies. Now, most healthy males produce anywhere from 2 to 10 milligrams of testosterone daily. The hormone from steroids help retain dietary protein used in muscle rebuilding. Now that we know more about steroids, how do they really work? Athletes who have used steroids report an increase in the lean muscle mass and endurance, but there are no studies to show that they actually improve performance. Neither do they improve in skill or agility. Some say that steroids help recover from injuries, although there are no studies to back this up. Although little evidence showed that steroids enhance performance, according to sportsmedicine.com, the International Olympic Committee has now placed 17 steroids on their ban list. Being that they seem so natural, what are the health hazards? Now, reports from athletes offer visible evidence of their side effects. And side effects such as rapid weight gain are easy to see, however, some are internal and are not so easily noticeable. They can also trigger cancer, diabetes, arthritis, and other health problems such as impotence, baldness, acne, bad breath, and high blood pressure. With such severe health hazards coming from steroids, how is this affecting our youth? Teens are abusing these drugs to improve athletics, but also their physical appearance. Drugs can also prematurely halt the growth in our youth. Even small doses can affect growth. Steroids are rarely prescribed to youth and children. So what are the government doing to protect our youth from these steroids? Federal regulations make it illegal for a doctor to prescribe growth hormones or steroids prior to doing an examination. Now, in order to diagnose a patient with growth hormone deficiency, a rare condition, a test must first be done to monitor the pituitary glands, which is used in determining the deficiency. Felony convictions have also been given to doctors and other operators of anti-aging clinics. Now, an estimate showed that tens of thousands of people are injecting themselves with steroids daily. So while Congress is preparing to focus on baseball and other sports with these drugs, medical experts warn that they are being prescribed nationwide at an alarming rate, and it is very important to understand their dangers.